been throwing the sign-in link there as well as the QR code on the screen here. So.
All right, so I think we'll go ahead. Thank you, Ariane. I think we should probably go ahead and get started. So yes, if you haven't signed in yet, you can either, as Ariana said, scan the QR code here. We're going to move on to the next slide, but there's also a link to the sign-in form in the chat, and Morgan will periodically be dropping that in. So we are going to do a breakout here to get us started after we watch a little orientation video. Make sure you turn your screens on if you're able. Understood. If not, it's still kind of early. But it just makes it a little bit more fun if we're talking to faces and not black boxes. So we're going to get started with this is a repeat for several people, but it's new. We've got a lot of new people coming in as well. So we're going to go ahead and watch this 6-minute video that kind of gives, I hope, everybody some context for the work that we're doing as the Get Healthy North Country Network. So we're going to have Dan go ahead and get that started, and we'll come back.
Hi, this is Ray Babowitz from the Get Healthy North Country Community Integrated Health Network.
I'm not.
The purpose
No audio?
I can see it and
of
hear
this
it.
6.5-minute video is to tell you who we are, what our members do, and how we are working together to build and strengthen a chronic disease prevention system in the North Country. The Get Healthy North Country Network is a network of medical and behavioral health care provider organizations, public health units, area offices for aging, social care agencies, and other chronic disease prevention program stakeholders that collaborate to offer evidence-based health education products and services that are proven to improve quality of life and health outcomes. Our mission is to reduce the burden of chronic disease across our region. We envision a health and social care delivery system that emphasizes prevention, not treatment, of chronic diseases, and one that offers every North Country resident equal opportunity to live their healthiest life. Our network uses the same framework that Centers for Disease Control uses nationally to help organize and connect our members in a way that allows us to identify gaps, build synergies, and share resources so that we, as a network, are effectively and efficiently reaching and supporting those who are at risk for or in need of additional support to better manage a chronic condition. The CDC recommends that in order to prevent chronic disease efficiently and effectively, we need to ensure that we are coordinating efforts in 4 key domains, starting with epidemiology and surveillance. Activities coordinated in this domain involve research and data collection to help guide and prioritize program and service planning efforts. They also include development of evaluation plans that will help us monitor program and services impact on individual health outcomes and population health. This work is coordinated through our data team and supported by Adirondack Health Institute, who serves as our data hub. There are currently 2 chronic conditions being monitored by network participants: diabetes and heart disease. The Get Healthy North Country Network is specifically focused on diabetes at this time, whereas the Chronic Disease Care Coordination Network is focused on heart disease. Next is the environmental approaches domain. Activities in this domain aim to make healthy behaviors easier and more convenient for more people to choose. Programs and initiatives led by Get Healthy North Country Network participants in this domain area include creating healthy schools and communities, advancing tobacco-free communities, and the Adirondack Food System Network. All of these initiatives employ strategies that aim to change the context in which we all live, work, and play so that no matter who or where we are, we all have equal opportunity to choose nutritious foods, to be physically active, and to live a smoke-free life. Chronic disease prevention efforts in the healthcare system interventions domain aim to increase provider office identification of patients that have increased risk for or are already diagnosed with a chronic condition. GHNC network participants are involved with several initiatives that aim to support healthcare provider efforts to increase support to these patients. including the Chronic Disease Care Coordination Network, North Country Nicotine Consultants, aka Health Systems for a Tobacco-Free New York, and/or a Food is Medicine program. All of these initiatives offer technical assistance, resources, and other support to help provider offices promote and support patient efforts to reduce risk and better self-manage their health. Last but not least, we have the community-based programs domain. Activities in this domain aim to ensure that people with or at high risk of chronic diseases have access to quality community resources that can help them prevent and/or better manage their conditions. Several network participants have staff trained to lead chronic disease self-management education programs, the National Diabetes Prevention Program, and/or other evidence-based nutrition education programs. Our network also includes a growing number of tobacco treatment specialists who are trained to support people attempting to quit nicotine, either individually or in groups, and where a tobacco treatment specialist is not available. All North Country residents have access to the New York State Smokers Quit Line. Through the GHNC network, organizations that are providing all of these services have access to additional training and technical assistance opportunities through the St. Lawrence County Health Initiative for CDSME, NDPP, and the Heart Network for TTS. The linkage between clinic and community continues to be a challenge. We do not yet have a single easy-to-use process that provider offices can use to refer patients to community programs. The Chronic Disease Care Coordination Network's work plan includes activities to explore this and other barriers to getting patients connected. In addition, we are all hopeful that the social care network that will be established through the 1115 waiver program will result in identification and implementation of a system that everyone can use to facilitate referrals. The Get Healthy North Country Network is guided by the Integrated Network Development Committee, a committee of North Country Healthy Heart Network's board of directors. The INDC brings all domain stakeholders together to identify and address system gaps, facilitate resource development, and build synergies for success. I hope this presentation has helped you to understand not only the framework that the GHNC network is using to organize the guide planning. I hope that it has also helped you to see how all of our programs, services, and partner networks are working together to create a robust North Country chronic disease prevention system. For more information about what the Get Healthy North Country Network is doing and how you can get involved, please contact the email or number listed here. Thank you for your time and interest, and please come follow us on LinkedIn.
Wow. Ray, we haven't listened to that for a while. So that was the voice of Ray Babowitz, who is here with us this morning. And yeah, that was great. I haven't seen that for a while. We developed this earlier this year in an effort to try and, educate everyone, help everyone understand how we all, even though, none of us are doing any of these things.
The Uniform Code of Military Justice specifies court-martial for any officer who sends.
Okay. Anyway, so we put this video together so that, so that everyone could see how everything that we're all doing really fits together to create this chronic disease prevention system for the North Country. And so again, thank you to Ray for narrating that. You've got the perfect voice for this, Ray. So with that context now, what we'd like to do is go into some breakout rooms, have everyone introduce each other. We're going to do a quick little icebreaker. You'll introduce yourself to your small group, and then think about, as you're going into that breakout room, based on the video that we just watched, where do you fit in? Where does your organization fit into this chronic disease prevention system? And share that with the people that are in your group. So we're going to go ahead and go out. We'll take about 10 minutes for you to go around and chat with each other, and then we'll reconvene here as a group. So have fun. Oh. All right, I think everyone is back. We did lose a few people that I'm guessing just weren't ready to get into a breakout room at this hour, at this early hour. So anyway, welcome back, everyone. Before we move on for the rest of the meeting, I just wanted to hear, what some big celebrations are. What are people celebrating this month?
In our group, it was a lot of positive things, a lot of birthdays, marathon training, good health diagnoses, and I'll shout myself out. I have a year of sobriety under my belt as of January 1st. So I'll be really
Katie.
excited to hit that.
Katie. Wow.
Katie, I don't like that you're minimizing the snow thing, the return of snow.
That's because I hate
No
snow.
return of
Some people
We had
were
a
really
little love-hate
excited
in our
about the
group
snow
there,
returning.
man.
I am not one of those people.
Oh, that's great. Well, congratulations, Katie,
Thanks.
and happy birthday to all of the birthdays that are being celebrated this month. That's great. What else have we got going on out there?
I had to drive through Watertown to go to Syracuse yesterday, so that was an interesting drive.
So you're celebrating the survival of that
On
trip.
her birthday, as
On your birthday. Wow. Wow. That's amazing.
Ray, I purposely went there yesterday. What was I thinking?
Guys, we got a foot and a half more overnight, so that was nothing.
Oh my goodness.
Send it up
Wow.
north. Send it up north.
All right.
Yeah, I got to
Wow.
be 1 o'clock, Lindsay. I said, the heck with this. I'm getting out of here while I still can.
I don't blame you at
Wow.
all.
And this is lake effect, or is this was
It was lake effect, yeah.
lake
Yeah.
effect? Wow. Wow. All right. Anyone else have something that they want to share? I will share that on this very day, I am in Colorado, and I am here to celebrate my youngest son's graduation. He's graduating from college today. So
Nice.
That's
Oh,
awesome.
We're
we
excited
had
about
that
that.
too. Ron's son just
Yes.
graduated
We
from
did,
college.
yes.
Yeah.
So I'm going to ask the same question that I asked Ron. What are you going to do with that extra mortgage payment that you no longer have for college? A nice tropical vacation, or
maybe take some more trips. Yeah, maybe. I don't know. Yeah. Anyway. Oh, that's great. Well, congratulations. That's great. It's good to hear all the good news that's out there. So, let's go ahead and move on. So the rest of the meeting is going to really keep that framework in mind. The first part of this meeting is really more focused on the Integrated Network Development Committee, which, as you may recall, is that's what brings all of this together and kind of guides the work that we're doing. So I'm going to be sharing an update on what we've been working on as a network, and then we'll go into the different domain area updates, the domain areas that we're really focused on right now. So I'm going to start with what we've been working on from a network perspective. The Integrated Network Development Committee is really focused on, we've got different strategies that we're really focused on. We have a number of strategic priorities. As you all may remember, we did get update our strategic plan earlier this year. We identified there were 3 strategic areas that we're really focused on. One is governance, which we're not very focused on right now because we did a lot of governance work last year and the year before. So this year, we're most focused on our revenue development and marketing communication strategies. And so in the revenue development area, strategies that the Integrated Network Development Committee have gotten us really focused on really fall into 4 kind of buckets. One is identifying and approaching health insurance companies to explore their interest and to encourage their investment in delivery of these programs that you all are offering. Also health insurance, but on the employer side, large employers who are experience rated or are self-insured, they have a lot more incentive than a smaller business might have, because the money that they pay for their health insurance premium is based on utilization. So approaching large employers to, work with them to encourage their investment in these programs. in that area, we actually did have, we just had our first meeting with a large employer that's based out of Plattsburgh. And I would say that that initial meeting was very positive. And we have been invited to come back and do actually make a proposal in January. So that's something that we're going to be getting very focused on here. We've also been working, another strategy is to partner with employee assistance programs to see how we might be able to integrate these services into the EAP model. And there is a local provider of employee assistance services through Behavioral Health Services North. So we've started a conversation with them. And then, of course, we're continuing to pursue the grant opportunities. We did just submit an application to renew or continue the New York State Rural Health Network development funding that was open for proposals recently. That just wrapped up this week, actually. So those are the things that we're doing right now to really, generate additional revenue. So looking for ways, strategies to generate more revenue. So I see, Michelle, you have your hand up.
Yeah, and they actually announced to employees about a month ago here that they're going to be starting a new wellness committee here at the hospital. So I don't know if St. Lawrence County is in your radar for something like this, but might be an opportunity to partner with us.
Absolutely.
I can connect you with whoever, if that's something that you're interested in.
Absolutely. Yep. Yeah, no, that sounds great, Michelle. Thank you. That's great. So that's what we're really focused on for building more revenue to support the work that we're all doing. Anything else that we need to throw in here from the INDC members that are participating in this meeting? Any other questions? All right. So the other strategy area is marketing and communications. We're really working on, and this was based on the marketing and communications strategy was selected as a real priority for the network because based on the network member survey that we did earlier this year, we found that members don't necessarily understand what each other are doing and how you're each participating in this this chronic disease prevention system. And so the activity that we just went through is one example of a strategy for helping to improve that. But we've created a LinkedIn account. You should all be getting weekly e-news updates from the network. We're trying to keep those e-news blasts limited to just one item, not a whole digest of articles, but just one quick, here's an announcement from the network. So those are going out weekly now. And we continue to do quarterly earned media events. So we just had an op-ed actually published in the Post-Star a couple of weeks ago. And, these are all ways for us to be educating each other about what we're doing. It's also an opportunity for us to be educating the community about what Get Healthy North Country is doing. We also have developed going up to the revenue developments, the payer strategies, we needed some collateral to be able to communicate and, start marketing those services to potential payers. So we've developed a brochure that really outlines the work that we're doing. And we've also started to get to professional conferences and present the work that we're doing because often that's where, we also connect with payers that are interested in investing in this region. So we have a small regional conference that we're going to be participating in this month. Julie Cook from the Health Initiative and Laura Morris at AHI are going to be presenting a poster at a CVPH quality walk. I don't know I'm not sure how to call what to call this, but it's just a way for us to be getting out and communicating with each other and with the community about the great work that we're doing. So that's what we've been working on in the strategic priority area. Any questions about any of that? If you're not following us on LinkedIn, this is a call to action to please go follow us on LinkedIn. If you're not getting the e-newsletter, please let us know. Drop a note into the chat so that we can get you on that distribution list. All right, Dan, I think we're good to move on to the next area of focus for the INDC. So the other thing that the INDC does is it really monitors the, what's happening across the region and even what's happening nationally, but what things are happening out there that could have a potential impact on the work that we're doing as a network, where it's kind of a way for us to be, continuously doing a SWOT analysis, looking at our strengths, our weaknesses, our opportunities, and our threats. And so, what can we be doing to, to be getting the, kind of staying ahead of where the opportunities might lie or where the threats might lie. So one opportunity that we've obviously been following for a long time is the 1115 waiver. I think everyone at this point is aware that is finally happening. We do have what's called a social care network, which will be responsible for administering the 1115 initiative in this region. The name of that organization is Healthy Alliance. I know that they're taking applications from organizations that are providing health-related social needs services. And if you're not already connected with Healthy Alliance, please, again, drop your name into a chat or send us an email to let us know that you're wanting to get connected so that we can get you connected with them. So we are continuing to attend any meetings that they're offering. And my understanding is that in addition to contracting with organizations to get these services out into the communities, that we're also going to be forming regional work groups. And I'm anticipating that we'll probably start to hear about those forming in the near future. So we're all going to want to be keeping our eyes on that and getting engaged where we're able. There are several other people at this meeting that are much more informed about 1115. So is there anything else that we should add here? I'm thinking Katie or Lindsay.
Nothing really comes to mind. We're also meeting with them and kind of in the same boat as many of you, trying to figure everything out. Still not a lot of information from them, but I think that's really coming from the state. So,
okay.
I'm sorry. I think Jennifer was trying to say something too as well, and it wasn't working for you, Jennifer.
Yeah, it doesn't seem like the microphone's working.
Also, I just want to call out Dana's message in the chat, Healthy Alliance.
Dana, you're looking for connection to Healthy Alliance? Okay. Yeah. All right. So that's a big focus and emerging need and emerging opportunity that we've identified. Our newest emerging opportunity is what we're calling focus on equity. We are, as we look at the data, the demographics of the individuals that have been participating in programs, we're finding that we're not getting good reach, particularly into the Medicaid population, low income population. So we're really wanting to understand, how we can make these programs more accessible. So there are, I think, 12 of our network member organizations that are going to be participating with us on the Focus on Equity team. Anyone that's not already connected with us on that, again, drop a note into the chat and we'll get you added. But we kind of launched our work together at the Adirondack Foundation's Collaboration Lab. This was held in early November. And so what we're going to do, what we talked about at that lab, I'd say that there were a few big takeaways from that day. One was that we've identified a need to do some focus groups. I think we need to reach out and really have some conversations with individuals that we're trying to reach to understand, what the barriers are and how we might be, what we can do to make these programs more accessible and easier for people to participate in. We also we're making some assumptions about what some of those barriers are. And a couple things that came out of that discussion included, one, many of us are still using, as we're delivering these programs and marketing these programs, we're calling it join our chronic disease prevention self-management program or our diabetes self-management program. And we're recognizing or suspecting that that's probably not a very interesting program title or name for a program. So how might we rebrand the program names so that they sound like something that people would be excited to get involved with. And the other thing that we talked about was that these programs that our network members are offering right now are really, they're pretty intense programs. It's a big commitment. So you've got to sign up for a 6-week program or even a 12-month program. And that takes a high level of commitment and a high level of engagement. And that's not everybody's ready for that. And so, what kinds of things can we be doing to give people little snippets of information that will help to increase their level of readiness to get involved with a more intense program? So we talked a lot that day about, strengthening our partnership with the Cornell Cooperative Extension's SNAP-Ed programs across the region and working through those programs. And this maybe is not the right word, but using those programs, partnering with those programs and thinking about them as a pipeline to helping them to identify people that might be ready. They may not be ready, but working with SNAP-Ed to help us identify people that could be ready and then make referrals into our programs, and vice versa. We're certainly serving people in our programs that could benefit from the menu of programs that are available through SNAP-Ed. So how can we be referring people out of our programs into the SNAP-Ed programs so that they can be getting additional information? So we're very excited about this. I think there was a lot of energy at the collaboration lab, and we are going to be hiring a network outreach and engagement coordinator who's really going to be responsible for helping us to advance, the work of the Focus on Equity team, as well as other aspects of, the work that's being done for the network. So those are the things that we're really focused on from a kind of a network development perspective. Again, this doesn't fit into the domains that you saw earlier, but think about the chronic disease prevention system and all of the sustainability work that needs to happen in order to maintain, as we move into the future, to keep all of these different programs and activities in play. So that wraps up the network update section. Any questions before we move on to the domain updates?
I'm just looking at the chat. It seems there's some discussion regarding the Healthy Alliance trainings and the trainings that are held by Healthy Alliance. It just seems there's a little confusion there. I don't know if it's something worth discussing. Yeah, Katie, I'm going to point to you because I actually have not seen the training information. I think there are trainings coming up that are that in the organizations that are participating as part of the Healthy Alliance social care network are going to have to go through as part of the credentialing process. Katie, can you comment more on that?
Sure. So there's a Healthy Alliance user training that is ongoing. There's training options for screeners and social care navigators. That is ongoing. There's training options for contracted partners and lead administrators. I have a Word document up that they sent over because when we met with them on Monday, there was certainly a sense of urgency that all of this work needed to be done. We don't even have a contract to look at yet. So I know that Karen did share with their leadership, kind of just to be mindful of their approach with partners. It's a little confusing to us to hear this sense of urgency, and we're trying to figure out who from our health home team would be, the best fit to do these trainings and who from an administrative standpoint needs to be involved. Yet then we hear nothing from them for several days, and we have to be proactive and ask them for the info. So I think they're just, I'll give them the benefit of the doubt, like I said during the INDC, that they're managing 3 regions, hiring all these people, probably getting information from the state, like trickling in that they need to react to, change information that goes out to partners. So I want to balance what I'm saying with that. They're dealing with a lot, I'm sure. But it is a little frustrating because it's hard for us to be strategic and plan out who needs to attend what when we don't have a contract and we're not sure what's being expected of us, yet you're telling us that all these trainings are happening now and we need to go to them. It's like, so what is it? I do know that there are going to be more trainings in January, so I don't want anybody to feel stressed about that because we're not stressing about it. With the holidays coming up, let's be realistic. Like, you can't expect a whole lot of work to happen beyond next week with people taking time off. So
yeah,
it's kind of mixed messaging. We'll see, and I'll continue to communicate anything with you, Anne, that comes up. But like, we're meeting briefly today internally just to kind of figure out, like, we know that there are some trainings next week. Can we send some people at least to start the process?
Right. Yeah. Okay. Yeah. And I think, so yeah, thank you, Katie. And I think as when any of you hear about, something that's coming up, if we can be sharing with each other, certainly share that with me so that we can be pushing it out through our, through our e-news distribution list. We want to be able to, we definitely want to be able to keep the information out there. It does feel like the information is fragmented and intended to be targeted to particular, types of organizations based on where they are in their contracting process. So, which makes it a little difficult. I think the communication is challenging, but
yeah, and they want, obviously they have to get set up for a 1/1 start. And they have a goal of, I believe, screening 25% of all Medicaid members by March 1st or within the first quarter. I don't recall. So because our role at AHI is primarily to be screening and navigation, that could be why they're meeting with us kind of before others who may be the social needs providers, kind of the next step beyond screening and navigation. So I will say that that's maybe why we've met with them and others have not, is because we're kind of seeing the patients as they come in and screening them for the next step. So that could be where their focus is right now, is just getting the entities that would be tasked with screening and navigation set up first before the housing, nutrition, transportation providers. That's my insight and my insight only. So take that for what it's worth.
No, it's good. I think it's good for us to, to be able to just keep talking about it together. And because when we take these little bits of information that we each have and put it together, I think we have a better sense of, what really is happening. So thank you. All right. I think we're going to move on. If anyone is interested, though, and you're not already involved with Focus on Equity, not a lot has happened. We've done the collaboration lab. Because of the grant writing needs, I have not done the follow-up to that group, but that will be happening. And we'll be getting that group back together after the first of the year to take a look at an action plan that will take our work forward. So if you're interested and you're not already involved, definitely let us know. And with that, I saw the slides moving around, which I think might have been a cue for us to move on.
No, I was scratching something off on the trackpad and it must have just went wild on the slide. So my apologies.
Okay. All right. No worries. All right. So we're going to move on to, again, think about the chronic disease prevention system and the 4 domains. One of those domains, the next focus here is on the clinical domain. And so I don't know that I'm going to just turn it over to Katie and Amy for any quick updates that they might have.
Yeah, sure. Hello, everybody. I'm Amy Kopansky from the Heart Network. I know most of you on this call, but not everybody. I think we have some new people, so you may not be as familiar with the CDCCN. So just real briefly, it is a grant that was awarded to AHI. It is a 4-year grant, and we're currently in year 2, quarter 2 of that grant. One of the main purposes of that grant, or goals you could say, is to increase referrals from the clinical setting into the chronic disease self-management programs, into nutrition programs like SNAP-Ed, as well as tobacco treatment specialists. So currently, we are working with 5 organizations to set up pilots that will be starting early in 2025 to set up the systems, the workflows, et cetera, to get more people enrolled in these types of programs. And we're using strategies that involve care coordination. So taking that burden off of the providers per se and giving it to the care coordinators who can have the conversations with people and get them into the programs that will help them in their lives. And it's mostly like lifestyle change programs. So that's what our work is. And just one other little update about that is we are currently working with the North Country Workforce Collaboration to put together a conference in 2025. It's to be held in Lake Placid, and the dates are May 21 and 22. The first day being a half-day optional program that will have one particular focus, and then the next day will be an all-day program. So keep your eye out for that in the near future, especially if you have care coordination on your team. It'd be great to send some folks to that. And I think that's all I had for updates for you at this time. Katie, feel free to add anything if you have anything additional.
That was a great summary. Thank you, Amy. I'll touch on the webinar we had on Monday and kind of the importance of next steps with that. So, and if you did not receive information on this, I do apologize. We did push it out quite a bit, but maybe it didn't reach you. So on December 9th, we had our TA provider, Ann Abdella from the Georgia Health Policy Center, do a webinar on the Medicare physician fee schedule from 2024, specifically the community health integration and principal illness navigation codes. CMS is really making an effort to also bridge that community and clinic linkage. And they've established a set of codes that some have decent reimbursement, where clinical providers can work with community-based organizations on things with their patients, such as health system navigation, even like lifestyle management, setting goals. There's a whole suite of things. And I'll actually throw the slides in the chat so that you all can see it if you haven't already received them. But she put on a really great session on Monday, and it wasn't as well attended as I think Amy or I would have liked. But for next steps, we'll be kind of fleshing this out at the January 27th monthly CDCCN meeting. But Anne is looking to do a follow-up session, 2 of them, if there is interest. One specific to community-based organizations interested in how they can develop partnerships with clinical entities on this work for Medicare patients. And then a session specific to clinical partners also looking to establish workflow, partner with CBOs. When I say partner, I mean contract with CBOs for this work. So if that is something that you would be interested in, please reach out to Amy or I, and we can make sure that that information gets back to our TA provider. I think it's really important information and really could be the further evolution of the work that Amy and I, and really this whole network, are doing, is trying to bridge that community to clinic linkage. CMS has put forth codes and reimbursement to do that. So we should really look at how we can build a workflow and a system in place that allows us to capitalize on that.
Mhm.
Yeah, thank you, Katie, for adding that. Yeah, that's important for our sustainability in the long run. I will just address Elizabeth. I wanted more information about the conference, and that is yet to come. We are still working on our keynotes and our presenters, but you certainly will be getting something soon as far as an official save the date. We haven't quite gotten that far with it yet, but we'll make sure everybody here gets that information. And I also wanted to say, if anybody doesn't have an invite to our monthly meetings, please feel free to drop into the chat that you'd like that, and we'll make sure that you get added. As Katie said, our next, that's the 4th Monday at 3 o'clock is when the meetings are. So we're happy to add you. Thank you.
Amy, can I just jump in for 1 second and ask a question about the workforce thing? Is it going to be focused on youth or adults or both, or employers, or
our conference
education? Yeah, the workforce piece.
So our learning objectives are, I'll kind of just go over them really briefly. We're looking to have presentations that are focused on improving patient engagement and care management, addressing barriers to chronic disease and lifestyle management, developing leadership and crisis management skills, workforce development and sustainability, collaboration and multidisciplinary partnerships, and then enhancing care coordination for individuals with chronic disease.
Got it.
So we don't have it all kind of fleshed out yet, unfortunately. We did nail down a closing keynote, which we're really excited about. He's a nationally known speaker, and we're pumped about that. But we're still kind of figuring out like what where everyone's going to kind of land in this theme that we've come up with and the learning objectives.
Well, I'm going to throw in one thing. I don't want to get off track here, but involving youth in healthcare is something that's really surfaced in our work and in healthcare planning and healthcare communication. And I don't know how that fits into what you are planning, but that seems like a way to help transform rural healthcare coordination. I don't know. Just throwing it out there. Ideas to think about. Put it in the percolator.
Yeah, I do appreciate that. Unfortunately or not, it is in our grant that we are adult focused. So that's why you may not see as much with the youth. I'm not sure if the NCWC has that same adult focus. We may not be able to put that into this conference necessarily because of that, but certainly it is something for us to think about in the future if we can't do it now.
Well, if there's something for them when they get there, I might be able to help find the funding to get them there if there's something there for them to help to partake, to like bring their brain power to.
Oh, I see what you're saying. Yeah.
So we can talk more about that. I can't make any promises, but it seems like an important partnership to address the Essex County priority, top level priority to address youth obesity, and which corresponds to diabetes. So I'm just connecting the dots there. Don't know exactly how to do it.
If we don't start engaging our youth in that, then we're going to have this as a continuing problem for sure. It's a key point in prevention. Thank you.
Yeah.
Yep.
Yeah, super interesting. Thank you, Elizabeth. Yeah. All right, and thank you, Amy and Katie, for the update. So lots happening there. Ariana dropped Amy and Katie's email addresses into the chat if you want to reach out and get involved with their network. You can do it that way or send us a note. Lots of ways to get in touch. All right, so let's move on. Thank you for the clinic update. So again, that's the bottom right side of that, the 4 domains. On the left side at the bottom is our community domain, so programs. And I'm going to turn it over to Dan.
All right, thank you, Anne. Good morning, everyone. Please bear with me as I try to operate my notes, the slides, the people, and the website I'm about to bring up, but we got this. For those of you who don't know me, my name is Dan Sweet, and I work with the Heart Network. I'm going to give you a quick program update, and then I'm going to let Julie Cook from the St. Lawrence County Health Initiative talk a little bit about the peer leaders and the peer leader training opportunities. So first and foremost, I want to give a huge shout out to the St. Lawrence County Health Initiative. They're our technical assistance and training center. They've been working super hard in order to build up the network capacity to deliver programs between their peer leader trainings, their cross trainings. So a huge shout out to Julie and Jerome. Thank you so much. We appreciate everything you do. The Heart Network meets with the Health Initiative on a weekly basis to schedule programs at least 3 months out. You can see the website, gethealthynoco.org. I'm going to give you a quick show of what we have on the website right now. So when you go to gethealthynoco.org, it brings you to this, and it shows all of the workshops we have coming up. So as you can see, between now and March, as we try to schedule about 3 months out, we have 6 workshops that are being offered in a variety of formats. We have in-person, virtual, or live online, as you see here, a couple of hybrid formats, and we also do telephonic. We don't have any telephonics now, but stay tuned for that. And let me get back to the spreadsheet, or the you can tell what's on my mind. So we're working towards building a comprehensive schedule where delivery organizations, they're able to coordinate on kind of a region-wide level to offer continuous chronic disease self-management workshops to everyone within the region. And if you're unfamiliar with the formatting of the workshops, most of them take place over the course of 6 weeks, as Anne said earlier, meeting once a week for about 2.5 hours. Julie, Jerome, and the other master trainers realized that for people with chronic conditions, it may not be the most realistic approach. That 2.5 hours is kind of it's a long time for them to just be sitting. So they looked for alternative delivery methods, and they pitched the idea of using this work-life balance format, which we'll speak a little bit about, for the chronic disease self-management workshops. The work-life balance format, it shortens up the meeting times, but it increases the frequency of the meetings over 6 weeks. So in this work-life balance format, people are meeting twice a week for 6 weeks, but the sessions are only 1 hour long. So it makes it a little more realistic for people with chronic conditions. Another strategy we're working on is to boost enrollment in our workshops is going to organizations where people are already gathering and recruiting them as host sites, or those are just sites that are willing to allow trained peer leaders to come in and deliver workshops. Morgan Greenwood, who's our community engagement coordinator, who's on this call, she travels throughout the region to meet with these sites and to speak with them. So if anyone has an idea about a good location where people are already congregating, and they may have, a private room where they would be open to these workshops, please reach out to us. Please reach out to Morgan. I believe Morgan's contact info can be put in the chat by Ariana. But yes, please reach out to Morgan. And then earlier in the presentation, Anne mentioned the focus on